Hello, everyone. Good evening. We are glad that you're able to join us today on this space. My name is Achieng Otieno from Being Africa. And as always, Being Africa is a platform to inform, inspire, and involve everyone in the fight against non-communicable diseases. So today's space is going to be a very interesting one. Just as the rest of the spaces have been, it's been informative. They've been informative, and today's space also promises the same. So I see we are 6 minutes late from our scheduled time, and I wouldn't want to take much time. Let me invite Valerie just to take us through the session. Before Valerie comes in, I would wish to welcome all of us. Let's be ready to learn, and let's be ready to be inspired. So Valerie, take it away. Thank you.
Thank you very much. I hope you can hear me. I'm really somewhere not so much okay, but I'll try my best.
Yes, we can hear you, Valerie.
Okay, thank you so much, and good evening, everyone. Thank you for joining this space tonight. And I can see our speakers already, Tanuja and McKenna already here. So I'll quickly go to introductions, and I'd just like to welcome you all to today's space that will be focusing on uterine cancer, as June is Uterine Cancer Awareness Month. These are some of the cancers that people think are rare, but it's only because we don't speak much about them. Fortunately, today we are going to hear about the risk factors, how to prevent, take cautions, what are the treatment options for uterine cancer, and majorly to focus on prevention. So welcome everyone. And my name is Valerie Aura. I'll welcome the speakers to introduce themselves shortly before we start. So I'd like to start with Tanuja. Please go ahead and introduce yourself and say hello to the audience.
Hello, everybody. My name is Tanuja Malde, and I am a survivor from uterine cancer, and happy to be with everybody to share my story.
Thank you very much, Tanuja, and welcome to this space. McKenna, please go ahead and introduce yourself.
Good evening, everyone. My name is Elizabeth McKenna, nursing officer. I work at Nairobi West Prison Dispensary. I also do cervical cancer and mentorship at Langata Kibra sub-county. Thank you and welcome.
Thank you very much, McKenna. And to the audience, you can always use the hashtag, her reason for being, to keep the conversation going. If you need any clarifications, if you'd like to ask a question, please go ahead and ask for the mic, and we'll definitely allow you to be a speaker and to contribute to today's discussion. So without wasting much time, I'd like to today start with McKenna, and just to give us an brief overview of what uterine cancer is, and what is uterine cancer, what are some of the signs, what are some of the risk factors, just give us a brief overview of what we are about to talk about. So welcome, McKenna.
Valerie, and everyone. Month of June being the cancer awareness month, we need to can you hear me? You can't hear me.
I'm sorry, McKenna, we are not able to hear you. It's like if you're using microphones, I think there is a problem. There's so much echo.
There's echo. And now?
Yeah, I think you can go ahead so that we can know if you continue. Or the echo is still there.
Okay, let me move to a different place. Maybe it's where I am. Is there still echo? Hello, hello, hello. Can you hear me now?
Yes, but the echo comes and disappears. I don't know what the problem is.
Valerie?
McKenna, are you able to speak now?
Can you hear me now? Is it
Yes.
better?
Yes, it's much better.
Okay. Sorry for that. The technology is giving us a lot of issues. So I'm supposed to talk about uterine cancer, the causes and the types. So let's first try and understand what is a uterus. Basically, in layman language, the uterus is the womb, and the work of the womb is to carry pregnancy during the reproductive age. It's also where the menses forms during the menstruation, and it flows out through the cervix and down there. So the uterus has got 3 layers: the inner layer, which we call the endometrium, the middle layer, which we call the myometrium, and the outer layer, which is called the perimetrium, which continues with the peritoneum, or the lining of the abdomen. So when we talk about the uterine cancer, it's basically the cancer that affects the womb. And the most common cancer affects the inner lining, which is the endometrium. And it's usually the endometrial cancer. Then and this one affects up to 95% of the women. Then we have also 5% of women suffer from cancer of the myometrium, which we call sarcoma, or basically the cancer of the muscles of the uterus, the middle label. So this cancer, as you know, most of them appear in the later stages of life, or women who are above 45 years. Although we have very few women below 45 years who can experience these types of endometrial cancer. Are you clear up to there?
Yes, it's clear
Hello?
unless there's a question. Yeah, it's clear unless there's a question from the audience.
Okay. Then the first question was about the common types, and those are the 2 common types: the endometrium, which causes for 95%, and the myometrium, which causes 5%. The myometrium is extremely rare, or very few people get it. But the one for the inner lining is very common, and you experience that many women get this. And the symptoms, the early symptoms is intermenstrual bleeding. You find like a woman after 45 years or after menopause, they bleed. You see they're bleeding. You also can get bleeding in between the menses. Like my menses comes every 28 days, but you find I'm bleeding in between. There could be also a discharge coming out for women who are post-menopause. There is also pain during sexual intercourse. There is also cramping or severe cramping during menses, or even when there is no menses. So these are some of the common signs, and they can overlap with any other symptom. That's why we always say that it is always important that the people get checked when you experience such symptoms, because cervical cancer or any other pathology of the reproductive system can present with the same problem. Usually, there is no way of knowing that this is cancer or it is another problem. So it is usually important for women to go for screening. And this screening usually we do, there's no like pap smear or something. So it is through ultrasound, or there is a test. You just go to the doctor or a gynecologist. They will remove the part of the endometrium or the inner lining. They take a biopsy and it will go to the lab for testing. They will just scrape that that part of the uterus. Is also called curating. They remove the tissue and it goes to the lab for testing, and they will check whether they are cancer cells or not. So that is basically the main testing. You can also do a very advanced test like CT scan and MRI. They are also able to detect this cancer. So for women health, women who are above 45 years, it is always important that you go for regular checkup, probably annually, even if you don't experience any symptom, because these endometrial cancers, they are really curable when we get them early enough. Therefore, it is upon each and every woman to take health issues very serious and get screened once in a year for the endometrial cancers, or if you experience any pain before really the advances, because you realize sometimes when symptoms start coming, the cancer is already advanced. So we send the cause, some of the causes of the endometrial or uterine cancer. They are not, we are not able to prevent. Like you find women who get hormonal replacement therapy, like you undergo removal of the ovaries, which is supposed to produce natural hormones, then you get the replacement. Basically, when you get a lot of estrogen in your body, as you know, there are two hormones in the body. One is the progesterone and the other one is the estrogen. Therefore, estrogen is the main cause of the endometrial cancer. And therefore, women who are undergoing replacement therapy, they should be able to get checked regularly, because they are at risk of getting a uterine cancer. Also, in early years of life, you get women with the hypertension, diabetes, mellitus. Also, women who are obese, they are also diagnosed with uterine cancer. The reason being also, some of these conditions, they tend to be the hormonal receptors, because of the obese or the fatty tissue, they are quite available and causing the estrogen levels to be increased. That's why it is always important for every woman to maintain healthy weight, what we call a BMI between 18 and 25. Another thing is that how do we support a patient emotional and mentally through the uterine cancer diagnosis?
Sorry.
Okay.
Sorry, McKenna, I think you have to wait a bit. We wanted to hear the first parts, which was to understand, the causes and all that. Then
Okay.
Tanuja is coming in to
Okay.
share her lived experience a bit before we get to other discussions. Thank you so
Okay,
much,
sawa
McKenna,
sawa.
for that wonderful. Yeah,
Okay.
I think we can always use the chat box to ask questions. If you don't want to speak, you can always chat in the comment section to just ask your question as we proceed. So I'd like to invite Tanuja, who is a uterine cancer survivor, to please share her lived experience. And then now we can tell from what McKenna has just said if we can relate to the signs, the risk. So welcome, Tanuja, and please go ahead and briefly share your personal story. Don't make it too long from diagnosis and treatment.
Good evening, everybody. So, how did my cancer
Good
journey
evening.
start? Good evening. Can you hear me clearly?
We can
Yes,
hear
yes.
you.
Okay. So, my cancer started in 2020. In fact, it was February 2020 to be precise. And how was this diagnosed? For me, it was by chance. I went to the gynecologist to visit him, and this happened because my husband was in hospital, and I thought, I'm in hospital, why don't I go and see my gyno? So when he did an internal examination, he said to me, I don't like the bulky uterus, so let's actually send you for a scan. I went for a scan, and then when the scan results came back, he said the lining of the uterus looked a little bit too thick, and he would like to do further examination. So he said I needed to do a histoscopy, which I went for. So it was an admission into hospital in the morning. They took me to theater, so he did a histoscopy, and then he said, "Come back in the evening." He released me from hospital, and he said, "Come back in a week when the test results or lab results will determine, if everything is fine or not." So after a week, when I went back, that's when he said that you do have cancer, and we need to go through a surgery. So the first thing was to make sure that my heart and all my blood tests were fine before we could do the surgery. And then after, so we went into theater for the surgery, and they removed my uterus, they removed the fallopian tubes, they removed the ovaries, they removed the cervix, and also some lymph nodes um, from the pelvic area, which were all sent to the lab. um, the lab results probably came back in another 10 days or so, and that's when the next plan of action was determined. And in my case, the next plan of action was I needed to undergo radiotherapy. I needed to, which was 25 sessions, and I would need to do brachytherapy. So in my case, I think the cancer level was still early stages. It was mainly in the endometrium and in a little bit in the myometrium, and that's why I needed the radio and the brachytherapy. Yes, and so what happens after that? I did that treatment in the UK in my case because my medical insurance allowed it, and it was a work insurance, so that was very good. But the surgery and everything else was done here. The only downside was I was doing all this during COVID. um, COVID had just started showing up all over the world, and it was quite scary because there was no vaccine, there was no treatment, and all you saw on TV was COVID is killing this many people. So it was a very, very worrying time for me as I underwent my radiotherapy and brachytherapy. Do you want me to carry on with my story?
That's very much okay. I'd only ask maybe if you just mention or repeat some of the signs that you had and maybe assumptions that you had made before even going for checkup.
Okay, so as McKenna said, in my case, I thought I was undergoing menopause, and that's why I was having irregular bleeding, which should have been a first marker. I was also having discharge every now and again, a brownish discharge, and sometimes with a little bit of blood. I am certainly obese, so not on the right BMI. Um, I have type 2 diabetes, so that should have been a warning sign. I have high blood pressure. So, all the signs that Makana was talking about, I did have them. But I guess, the challenge is sometimes you shy away from going to see a gynecologist very quickly. So, yeah, I mean, the signs were there. And it was only my husband being in hospital that forced me to go and see the gyno. And, the rest is history. So my recommendation
Thank you very much.
to people would be, you
Yes.
have your annual checkup at least. Go to the gyno. Don't just go to the gyno when you are having babies. It is important to see a gynecologist at least once a year.
Thank you so much, Tanuja, for bravely sharing your story with us. And I can really see the relatable risk factors that McKenna had mentioned, like the diabetes, high blood pressure, obesity as well. And now back to McKenna. Tanu just said that she had to go through surgery, removing all the, um, major organs like the uterus, all the way to the cervix, and So I'm just wondering, is is there any other option for treatment, or at what stage do you now have to experience all those surgeries? 'Cause I can just imagine in one body undergoing all those surgeries. And now that, I'm just trying to think if there are other treatment options.
Okay, thank you, Valerie. I think depending on the stage at which uterine cancer has been diagnosed, the management or the surgical or the guiding factor is really the stage. You see, she was removed, or we call it radical surgery, where you remove the entire reproductive organs. And then she was also done chemotherapy. This is the medicine to kill any cancer cells that might have spread to the blood and the lymph nodes. So it's she is lucky that she was able to survive because uh, uterine cancers and really developed. And I think the gynecologists are able to advise, and I think she was advised well, and they got the entire deceased system out, and she must be okay now. And we are happy for you, Tanuja, that you are well and able to share experience with us. Thank you.
thank you, McKenna. And also say that we need to regularly visit gynecologists to check on our reproductive health and about healthcare, especially in the
Valerie, I miss you. I've not got you.
reach out to them.
Hello?
Hello, can you hear me?
Yes. I've lost Valerie. I'm saying she's trying to connect back to us.
Maybe I can talk about, some of the challenges that I faced whilst, I had this uterine cancer. First of all, you are very, very scared to, when the doctor tells you that all your female organs are going to be out. Um, in my case, with diabetes, I was a little bit worried that, am I going to heal properly? Um, and I had to make sure that my sugar levels were absolutely fine, the blood pressure was absolutely fine before they took me into theater. And obviously, your blood pressure does shoot up when you know that you are going to undergo a major surgery. And yes, the doctors calm you down. They talk to you. So that part of it was fine. After they tell you that everything will be fine. Don't be scared. But certainly, it is a very, very scaring experience. Once you come out of theater, you feel relieved. I didn't want to see, what bits they had taken out, though they did ask me if I would like to see, the uterus and the ovaries, etc. But I said no, I wasn't interested. So, it went straight to the lab for testing. The other scary bit in my case was you it was COVID time. So when I was going through my radiotherapy, etc., I could not have any visitors. I stayed with my sister, who is actually on this call, Preeti, in the UK. She would take me to the hospital. Nobody was allowed to come with me inside for my treatment because of COVID. Um, but the hospital was very, very good. They made sure that I was taken for the radiotherapy immediately I arrived, and we didn't wait too long. So we had to drink all the water and everything that I needed to do for the radiotherapy beforehand. And it went well overall. Yes, you do get some side effects, but they were not too bad. The main side effect I was getting was diarrhea. I didn't really like to food very much, but my sister and my husband were there and making sure that I ate well, and I drank all my water. Water was a therapy in this case. And yes, I used to get cramps in my legs, but my two caregivers were very supportive. Sandeep is also on the call today, and made sure that they massaged my legs whenever I was in pain. So yeah, those were the sort of issues I faced in the treatment phase. some of the things that were also very, very critical was support, support from family, and support from sort of friends, by calling me, and that kept me going. I also started doing a lot of art when I was unwell, and that journey continues. We spent time doing card games, whenever we had a little bit of time. We would also do some simple exercises. At the time was mainly chair exercises, because I could not do very strenuous exercises. And it was really uh, people calling you and talking to you, and a lot of the people are on this call today, that were my big support mechanism when I was unwell.
Wow, thank you very much, Tanuja, for sharing that your experience. I'm thinking it's like Valerie seemed to be in a place where connection is not so well. So we'll be supporting each other with Sally just to run this session as we wait for Valerie to join us again. Um, yeah, that experience seemed to be. We know the pain. It was a painful experience. It was, and given the fact that you are also battling, there was COVID, and there was all this care that was in the picture. I'm sure there were a lot of things that were running through your mind, and I'm very sure that even from the experience that you've shared, there is a very important parts where support group or people that your support system sort of plays to just to help the healing process. Maybe you may want to share a bit about the importance of the team that was around you during this period, even as you are going through your treatment, Tanuja.
Okay, so the people that really helped me was my sister, Preeti, and Sandeep, my husband, who were with me in the same house. Nobody else could come and visit us because of COVID, and UK was very, very strict about that. So it was three people in the house, talking to each other face to face. But the people that helped me, friends would bring me food, leave it at the door for me, and talk to me from a distance. um, there were people who would call me and just talk to me on the phone. Everybody that was that could help was helping by talking to me. There was the Faraja Cancer Support that was very, very important as well, because they gave me direction on what I should do in terms of food, on what I should do in terms of alternative things that I could do while I was unwell. So, and really the moral and emotional support that you need during this very trying time. But everybody came forward, and it was very, very useful.
Thank you very much, Valerie. You're back. Tanuja was just telling us, explaining to us the importance of the support system as she was going through that treatment phase, despite the COVID scare. So maybe you can proceed on, Valerie.
Thank you very much for helping with that. The network is a bit shaky where I am, but I'm back. So thank you, Tanuja, for sharing your experience and how you manage to cope, especially emotionally. Sometimes, okay, most of the time, actually all the time, cancer is always an issue to the mental um, wellness. So it's very important to have support, as you've mentioned, and that is what makes healing even better and quicker. If you don't have support, then it's really, really hard to cope, especially emotionally. So I'd like to go back a little bit to McKenna and just understand, as I'd started mentioning before, how can better support uterine cancer research and awareness initiatives, because um, most women, especially in the rural areas, we know they still deliver at their home. So that means they have no access to antenatal care. They have no access to gynecologists, as some would have. And so how do we ensure that we don't leave them behind, and they may not also be aware of the symptoms of uterine cancer?
Thank you, Valerie. As we are all aware that some of these diseases, they are not reserved for the well-up, the affluent, and the educated. These diseases are for everyone. They affect everybody, rich and poor. So, one of the major issues that we need to focus, especially during this time of devolution, is to empower healthcare workers, the clinical officers, the CEO, the nurses, and all the community health volunteer or promoters working in the lower tiers of the healthcare system to be able to educate women on the existence of uterine cancer and the importance of a healthy seeking behavior, wellness clinic, and also giving the signs and symptoms about the uterine cancer, especially for postmenopausal women. Even a slight bleeding, it is a warning sign that you could be having something in that uterus. And therefore, it is always important for women to have a checkup, even when they feel essentially healed or when they experience some small or some minor discomfort. You should never assume. So, when women, you see many women and go to the hospitals, they go to the dispensaries, the health centers, level 4, level 5. And every time there is a missed opportunity that we could save these women just by talking to them. When they gather at the MCH, while they are waiting for the babies to be given the immunization, when they are waiting to be attended for antenatal, these are some of the inclusive healthy talks that we can put on top of family planning, the importance of completing immunization. These are also very important healthy talks that we can administer to the women when they attend the clinic. Also, we can do one-on-one when the nurses who basically attend to the women in the MCH, when they are empowered and they encounter these women as they do their procedures, they can always tell women about the existence of this uterine cancer. About the research, accurate data capture of women who have complaints in the lower levels and the linkage where they have been sent and the feedback of what was found. It is very important. Also reporting, because some of these information, we can even give the women information, but you are not documenting. Therefore, for us to come up with something, we must document what we are doing. We must document our findings. We must report our findings to the monitoring and evaluation team so that accurate decision can be made on the interventions that to prevent uterine cancer or to screening women, especially healthy women, health, wellness clinic. That package can include uterine cancer. Also, you realize that funding for cervical cancer through the Cancer Institute, it is not sufficient to support the research for all the cancers. Therefore, you see, prioritization is really what works in the resource-limited countries. Therefore, during the planning and the budgeting process, I think it is always important that we also put a tangible budget on research about the uterine cancer. Also, another department that could assist is the Council of Gynecologists, because at the end of the day, all the women diagnosed with the uterine cancer will end up in their pool. So for them to come up with some research and give us feedback on what is happening, and also assist in like policy development about interventions or screening at the lower levels can be very important. I think those are basically how we can do the awareness and the research at the same time. Thank you, Vala.
Thank you. I can see Vital Voices for Africa. You're now a speaker. Please go ahead. And I don't know if it's a question or a contribution you'd like to make. Sally is also a speaker, and I think you'll go next after Vital Voices for Africa. Yeah.
All right. Thank you very much. Good evening, everyone. This is Caleb Ayong, and I'm the Executive Director of Vital Voices for Africa. We're based in Togo. And I think McKenna, we're based in Togo, but we do work for the entire Africa, I should precise. And McKenna spoke quite a lot to the question I was about asking, but I guess asking the question could enlighten me a little more. First of all, I must say, I must agree with other people who have made comments on Tanuja's bravery. She is indeed a brave woman, and we say kudos to you, Tanuja, for being that strong woman you are. I noticed, I followed up keenly, and all of this happened to you in the UK, Tanuja. Perhaps in the UK you had the necessary resources required. Maybe you probably were lucky enough to have the opportunity to visit the hospital, and you had the instincts to go to the gynecologist. I'd like to come back to our African context, and that's why this question I'm asking to both McKenna and Tanuja, as one as a survivor and the other as an expert in the cancer field. My question gets back to the community, the local community out there. It's not common practice for women to go to the hospital for checkup. First of all, it's not in their nature to do that as a practice. Secondly, many of them will not have the required resources for this. And so I guess my question, and like I said, McKenna touched on this a little bit, talking about more resources allocated to research and capacity for such for these areas in public health. But I guess my question is, how do you think that if governments were to elaborate a strategy, maybe I should put the question this way: if governments were to elaborate a strategy, governments, development partners, and every other person, stakeholder who is concerned about this, if they were all to come up with a strategy to effectively support women with uterine cancer and other forms of cancer similar to this, what should such a policy look like? What should such a plan look like? I guess what I'm trying to ask, in other words, is how can governments, development partners, or just anyone, how can they effectively help women who are out there in this, in the villages, in the rural areas, who do not have a practice to go to the hospital and do checkups, who do not have the resources to go and do checkups? How can they effectively be reached and benefit from, from treatment? Because, of course, like we've said, these types of cancer can be treated when detected early. Thank you.
So let me just clarify once again. My actual diagnosis was in Kenya. My surgery was done in Kenya. It is only afterwards that I went to the UK, and the reason was that I had a health cover from my employer, which really helped me in the process. What I think would, just like breast cancer, you find that there is screening done throughout. And especially during the breast cancer month, you find that there is physical examination and feeling for lumps. You can even do it yourself. Unfortunately, with uterine cancer you can't do that, but what would be useful is if gynecologists could help by doing screening. Government gynecologists could help by doing internal examinations, maybe in the villages, um, and invite women to come forward and be examined. That would really help, because the first sign a gynecologist would pick up would be a bulky uterus, which is something that you can't do it yourself. Yeah. The other thing that I find is awareness, and it's nice that being Africa is doing the awareness. The uterine cancer is getting some awareness on the world map. So there, something like June being the uterine cancer month is a very good way of reaching out to people. If it could also be broadcasted on radio, television, etc., people will become more aware, in the different languages as well. Places like Faraja are also very, very good. They've built they have outreach centers. So when somebody is identified with uterine cancer, they do provide alternative therapies. They do have counselors. They also provide support, financial support, for people to get treatment if people can't really afford. So there is a lot out there, and it is just getting this to the masses across Kenya is what I would say.
Makena, would you like
Yes,
to add anything to that?
yes, thank you, Vital Voices. I think your concerns were about the women in the general population, which forms the majority of the women population. You realize that within the evolution, and then now every facility usually we have target of women of reproductive age, and in this target, actually, what is really lacks is that enforcement, like the way we do seriously following HIV, TB, case finding, that bit of the uterine cancer and the other non-communicable cancers is not well articulated in our African setup, simply because maybe the policy does not enforce that, or maybe there is a gap. And this gap is one of the way we are identifying that gap is like in a talk like this. And now I think what we should do when we are we already have a community strategy in place. And community strategy is the lowest level of healthcare system. The work of the community strategy is to identify the sick and link them to the healthcare system. Also is to do healthy promotion and disease prevention activities like hand hygiene, about the TB. I'm sure if we integrate about the cancer through the community strategy by training and educating the community health promoters about the existence of or about the uterine cancer, the same way we are now educating them about cervical cancer, about antenatal clinic, all these things concerning women of reproductive age and beyond. They should be able to educate women because these women are in their unit. Every community healthy promoter is allocated 100 households. And in these 100 households, there are women in these households. And the healthy promoter should be able to reach these women with this message that they should be able to have a clinical checkup at least once every year, even if they don't feel they're sick. And the healthcare providers in the lower levels should be empowered to have to be able to deduce the symptoms, and if they're not able to do the diagnosis, they're able to link the women in the higher levels and do the follow-up. Because sometimes you see the rigorous procedure for screening and diagnosis, they are intensive, they are time consuming, they are resource demanding. Therefore, many women, if they don't feel the symptoms have started, they will not pursue this matter. So it is important once we able to identify these women in the community, we send them to the health system, whatever level. The person who comes into contact with this lower level should be able to link these clients and be their primary healthcare provider until these clients get the treatment they require. You see, sometimes we refer and we do not get the check to ask the women what happened when they went for referral. And this is where we don't get exactly the women I refer. Where do they land? What happens to them? What is the outcome of referral from my facility? Therefore, these lower levels, a lot of investment through partnership. You see now, one of the to achieve the SDGs, one of the thing is about one of the SDG is about partnership. And this is where the government can partner with the partners, and they take this matter about non-communicable diseases, about uterine cancer, about other cancers, and we start with the lower levels of health centers. Staff training, capacity building is very important. On top of buying equipment for the level 5 and 6, capacity building and the equipment also for the lower tiers of the health care sector is very vital for the diagnosis, for early detection and the management of these women. I think if we are able to achieve this, we can say to a greater certainty that we can be able to reduce the mortality rate associated with uterine cancer by a greater extent. I think that's all I have.
All right, Victor, Caleb, I hope that was well answered.
Very well. Thank you very much.
Thank you so much. Any other question? Sally, I thought you wanted to say something, but I can read from the comments. I can't see any question at the moment, but there's one comment that Tanuja, you are bold. That is from Sally. Thank you so much. Yes, I also believe that Tanuja is so bold for sharing a story, especially, matters reproductive health. Women tend to shy away from speaking about them. But also, and that leads me to the question, maybe to either McKenna or Tanuja, what's the prevalence, especially in Kenya or in Africa, for uterine cancer? And also to McKenna, does age matter in terms of uterine cancer, or any woman can contract it, can be infected?
Thank you, Valerie. Prevalence in Kenya, we do not have precise data, maybe because of reporting, or maybe the reporting, we don't have a precise accuracy, but the prevalence rate in the US, which usually is a reference for our National Cancer Institute, is at 3.5%. And for example, only in the year 2021, 66,570 women were diagnosed with uterine cancer. It is not a simple number. About the age, at the introduction, I said that the prevalence is more in women who are 45 years and above. Although we see some women below the age of 45 years can get this uterine cancer, especially those who are obese or having diabetes or hypertension. Thank you.
Thank you. Thank you very much. Tanuja, would you like to add anything?
No, I think McKenna has answered that well. So
Okay.
here we don't really have statistics, but I am on Faraja's medical fund, and recently we have seen a few cases coming through for help.
Okay, I think it's because maybe the symptoms are maybe thought that they're for other diseases, or maybe because we have not really made people come out to speak about uterine cancer, because I believe now that you know some people, it means there are other people who are silent about it. Okay. I can't see any other question at the moment, and so also because of time, just ask maybe one last question to both. To Tanuja, what would you tell a newly diagnosed patient, or someone who knows someone who's been diagnosed with uterine cancer, or someone who's undergoing treatment?
My advice to them would be they need to have a support mechanism. It should be both family and support groups. Faraja has a gynecological support group, so they should join that. A healthy diet, making sure that they do some exercise, whatever they can do, um, getting fresh air, and the most important is being positive. This is a cancer that is definitely curable if caught early, and what I call it, what I would say is it is just an inconvenience for 6 months or so, because that's how long the treatment would be maximum. um, and then thereafter making sure that you have regular checkups. So usually with uterine cancer you need to do checkups for 5 years before you are deemed to be clear, um, and free. So making sure that they will do their regular checkups is what my advice would be.
Thank you. To McKenna, to those who maybe think that they're afraid of even going for screening, or they think that, they fear going for screening. So how do we ensure that we get more people, especially women, get screened for uterine cancer?
Eh, we usually say by not screening doesn't mean you do not have the disease. Therefore, our guiding factor is that this uterine cancer is curable when it is detected early. It is important that we do the screening to get the symptoms, we get the disease before the symptoms start showing, because sometimes when you get the symptoms, the disease is already advanced. Therefore, let those who are afraid know that by early diagnosis, the outcome is much better, and the earlier the diagnosis, the better the outcome. Therefore, we should encourage women to go for the checkup, and also the cost is lower when the disease is detected early. You realize, like, if I have already it is just starting, maybe I will do a hysterectomy, removal of the uterus, and I save my ovary and other reproductive health organs. But when the disease is diagnosed late, you end up removing all those organs and also going through chemotherapy. The process is straining, it is draining mentally, psychologically, it is draining financially and socially. Therefore, we should be able to diagnose this disease when the treatment options, they are able to give us a better outcome. Thank you.
Okay, yeah, thank you. Thank you so much. And I can't see any hands, so I think we may just go ahead and conclude because I don't see any other questions. Maybe your last words, and especially to Tanuja, you can also mention what kind of support people can get from Faraja.
So Faraja provides financial support for people who cannot afford to undergo treatment. NHIF provides some support, but the balance, there is an application process to the medical fund, and once and then there is an approval process. Once approval has been obtained, Faraja does support people financially, and then they have a support group mechanism which is also very, very useful. So there is a group where you find people asking questions, and responses are done. Every now and again they have some very good talks. So if there is a common problem on the gynecological group, then they organize uh, experts to come and talk about the issue at hand. So very useful to look at their website to see what they have available, and then make the most of the situation. They are based in Eldoret as well as in Nairobi. Nairobi just next to Mpisha Hospital, and in Eldoret at the um, MRT Hospital. What is it called? Moy Referral Hospital. And yeah, visit them and you will see all the things that they're able to do for people.
McKenna, your last statements?
Okay. According to our Cabinet Secretary for Health, cancer is the third leading cause of death in Kenya at the moment, and it is placing a huge burden on healthcare system, with the most of our level 5 and level 6 overstretched beyond limit. Therefore, for us who are working in the community, advocacy, creating awareness, we should take it up as our responsibility to ensure we educate people about healthy-seeking behavior, even when we don't feel sick, so that we're able to diagnose these diseases early and we get the treatment, we get better outcome, and we relieve the already overstretched healthcare system. Thank you.
Thank you. Thank you very much, McKenna. Thank you very much, Tanuja. And to our amazing audience, thank you for joining this space. And now we've just heard a little bit about uterine cancer. The whole month of June is Uterine Cancer Awareness Month. So we'll do our best to create awareness on that, get to the grassroots. We also work with the community, and we'll do our best to create awareness on the same. And we've really learned a lot today. And have a great evening. Thank you for listening and for being here. So I'll hand it over to Achieng to close it up for us. Thank you.
Thank you very much, Valerie. Thank you, McKenna and Tanuja, for the great insights. We've really learned a lot, and it's been an amazing session. Thank you very much to our lovely audience, and we've. As Valerie has pointed out, June is a Uterine Cancer Awareness Month, and uterine cancer, incidentally, is one
Acheng, we
cancer
can't
that is.
hear you.
Can you hear me now?
I can hear you. I'm not sure why Tanuja can't hear you.
I'm sorry. I'm sorry about that. Well, I was saying that.
He seems to be
Thank you very much,
muted,
Tanuja, for that.
Valerie.
No, I can hear him clearly. McKenna, can you hear Achieng?
Yes, I can hear loud and
Yeah.
clear.
Well, my apologies for that. Tanuja, can you hear me now? I'm sorry. I bet it could be some technical challenges that we're experiencing. My apologies for that. Our reason for being is basically to inform, inspire, and involve everyone in the fight against non-communicable diseases. And we are fighting so hard to ensure that this information is shared widely to inform our people, to inspire them, and also to get as many people as involved in the fight against non-communicable as possible. And as Valerie pointed out, throughout this month, we'll try as much as possible to raise awareness about uterine cancer, which is regarded as a rare cancer. But as clearly from our discussion today, there is a need for women to seek regular screening just to dispel anything that might not be working well within our health systems. So I may not want to take much time because our time is far much spent. I would just want to invite you once again for our next space, which will be on Wednesday. And we would also like to invite you to keep the conversation going on our social media pages. Keep the hashtag as her reason for being. And thank you so much, Vital Voices, for sharing your insights all the way from Togo. We love what you're doing in the continent, and we are happy that we are working together. Thank you very much, and good night, everyone.
Thank you and good night.